Yeah, my name is Dr. Sanjay Mathew, ADA member and Chief Medical Officer, and I'll be speaking about how to talk to your doctor about when medication can be adjusted in terms of dosing or switched, and how do you talk about side effects with your prescribing physician. And I think the first aspect that's really important when you're sort of getting a medication for an anxiety or depressive disorder is once you've made the decision in a shared manner with the prescribing clinician that medication is a good approach, to have a clear understanding about the framework for taking the medication. So is it a once a day medicine? Is it a twice a day medicine? Is it an as needed medicine? And then to have a clear understanding from the very beginning, what is the expected duration of the trial? So is this something that's going to be used for 6 months, presumably a year, or even longer, indefinitely? So it's important to sort of ask those questions so you know from the very beginning what you can anticipate in terms of dosing and the duration of being on the treatment. Another aspect that's important sort of at the beginning and then periodically during the course of the treatment is how are you measuring success, or in sometimes how are you measuring lack of success or failure. So often in clinical practice, you may be given a scale. You may be given something like a PHQ-9, which is a commonly used depression questionnaire, or something like the GAD-7, which is used to assess anxiety. So ideally, you'd be taking those kind of questionnaires at the beginning of treatment, get a sense what your baseline level of severity is, and then periodically over the several month or longer treatment period. So then you're in a position, let's say 2 months down the road, to see that, in fact, yeah, I have improved significantly in the PHQ depression score, such that I went from a moderate severe level down to a mild or mild to moderate level. So it's critically important that there is some level of what's called measurement-based care, such that you are tracking and reviewing with your prescribing clinician sort of how you're doing over time, because that is going to drive the decision about dosing. Should you increase the dose? So antidepressants are given in a range of approved doses. So the FDA approves a range, so several doses. There's a maximum FDA approved dose, and then there's a minimum dose. And so often you're started at the minimum. And if you don't have a 100% response, or if you're not in remission, you may go up on the dose. And you could continue to go up on the dose periodically, depending on sort of how you're doing symptomatically and how you're doing in terms of side effects. So if you're tolerating the medicine well, but you're not in remission, then it would make perfect sense to go up to the next level. And then at the next visit, perhaps go up to even the next level after that, depending again on your tolerability and your response, because the goal is to treat to remission. So in the PHQ-9 example, that would be a score of less than a 5. So you want to have really tackled the wide range of symptoms comprising the syndrome of depression. So that would be an example of when to go up on the dose. Now, what about going down on the dose? That's usually in the case of tolerability. And there are certain things you could do to keep the dose the same So for instance, if you're doing well, but if you have too much sedation, for instance, or sleepiness, the dosing could be moved all to the evening. Instead of splitting the dose, one in the morning, one in the evening, you could take both doses in the evening. So that's one way to potentially address if there is too much daytime sedation. But there are other side effects that may not be amenable to changing the time or the time of administration, and these may be side effects such as weight gain or sexual side effects. It is important to adhere to the recommendation should the drug be taken with food or on an empty stomach. So there are certain drugs based on how it's absorbed has to be taken on an empty stomach to enhance the absorption. There are other drugs that are commonly prescribed that should be taken with a light meal or a snack. And the reason for that is it will enhance how the drug is being absorbed. So that's a critical aspect. Now, what about stopping a drug entirely? Say you've finished the course, you've done let's say a 9-month trial of an antidepressant, and you've come to the conclusion along with your prescribing clinician that, yeah, it's a good time to consider stopping. We generally don't stop any drug cold turkey. So we try to taper over a period of time, and depending on the type of drug and how long the drug stays in your system, that taper period could last a week or two, could last longer in some cases, depending on the drug and how long you've been on the drug to date. So what we don't want to do is taper and get off the drug very quickly, and then that may set the patient up for not only withdrawal symptoms or discontinuation symptoms, it may also make the transition more difficult and set the patient up for relapse of symptoms. So what about switching? So there'll be some situations where you finish the course of treatment, you're doing very well, and it's good to be off of the medication. There's other situations where perhaps the trial didn't work out because of tolerability or lack of efficacy. So then in that situation there, you could do what's called a cross taper. So the drug is decreased in dose while there's an introduction of the new medication. So while one is going down in dose, the other one is ramping up in dose as a way to substitute. So that's commonly done in clinical practice. So other aspects with respect to sort of handling medication and monitoring, it's critically important to keep some kind of record of how you're doing. Some patients keep a diary and they'll record sort of improvements, or they'll record side effects, because if you're seeing your prescriber infrequently, it may be very difficult to really remember everything that's gone on over the last month or two. So the use of diaries can be very informative, and the diary could also be, it doesn't have to be extensive, but if it's a calendar, it could be a simple checkbox as to when you took the medication. Were you actually able to take the medication as prescribed? Because the hardest thing with any medication is often just taking it. Are you taking it as prescribed, the number of doses required as per the prescription? We know for chronic illnesses, psychiatric illnesses, but also medical illnesses like blood pressure, hypertension, and diabetes medicines can be very hard for patients to remember to take the medicine every day. And especially if there's side effects, there can be some reluctance to take it every day. So keeping a diary, noting when you took it, when you missed it, if you did miss it, noting any improvements or any comments or notes for the clinician is always a good thing. Now, it's also always helpful to have an informant come to the meetings with your clinician, because maybe your partner, your friend who knows you really well, a parent, a spouse, maybe they can provide some information that you aren't necessarily aware of. So maybe you haven't noticed much of an improvement, but your partner has noted, you seem much more motivated. You're actually sleeping better. You're sleeping through the night. So someone who shares their bed with you, they would have really good insight into, are you actually sleeping? So it's always helpful to the clinician, if possible, to bring in an informant, a friend, loved one, etc., who could provide cooperative or sometimes non-cooperative information. So other aspects of taking medications and adhering and sort of being in it for the long term are some of the issues with insurance. There could be delays. There could be issues related to insurance coverage or the need for prior authorizations, which would cause delay in you getting the medication. Or sometimes you see medications that were 100% approved by your insurance company, and then all of a sudden in a new calendar year or new fiscal year, it's no longer approved. So all of those things create some logistical hurdles. So it's critically important to sort of stay in touch with your prescriber, advocate for yourself, and hopefully your clinician will be sort of advocating for you and filling out the paperwork as needed for those prior authorizations. And then if there's issues with copays, sometimes copays can be very expensive. And so are there ways to achieve copay relief or other things that can be given to the patient via the website or other coupons or cards. And then it's always important to talk to your doctor, your clinician regarding special situations. If you're going to sort of be out of town for an extended period of time, not available for a pharmacy, can you get sufficient supply of medication so it'll last if you are away, or there are other issues. Always know where and how to store the medication. Most medications do not require refrigeration, but some do. Many can be stored at room temperature, but certainly controlled substances, you want to be extremely careful where you store them, who has access to them, and be mindful of the ability of people to sort of get into a specific medicine cabinets. And I think I will stop there. So thank you for your attention, and always welcome viewers to look at the ADAA website, which has a lot of resources on psychiatric medications, on for depression, anxiety, and all of the conditions that we treat and take care of as part of ADAA and the ADAA community. So I encourage you to check out the website. Also check out resources such as the National Institute of Health, National Institute of Mental Health.gov, and other well-known websites, including the Mayo Clinic. So thank you for your time and attention.